spend the second half of the briefing looking at some career pathway programs for healthcare providers in our state. And we'll start off with Dr. Susan Zahner. Dr. Zahner is the Associate Dean for Faculty Affairs and the Distinguished Achievement Professor at the UW-Madison School of Nursing.
Well, thank you, Sam, and thank you for organizing this panel and inviting me to speak today. It's a great opportunity to talk about one of my favorite topics, which is the nursing workforce. The registered nurse workforce numbers around 90,000 here in Wisconsin, and the numbers are going up very gradually. Just over half of those nurses work in hospitals. We have about 5,000, just over 5,000 advanced practice registered nurses. These are nurses that are educated and credentialed to practice nursing in an advanced level. Most are nurse practitioners. The numbers of nurse practitioners and other advanced practice nurses is increasing. We've had about a 19% increase over the last 2 years. We have just over 1,000 RNs that report working primarily as faculty in nursing schools, and most are prepared at the master's level. We have some geographic issues with nurses in our distribution. The lowest nurse per population ratio is in the northeast region of the state, and the highest is in the southern region of the state. So what's behind some of these numbers is some concerning gaps about the future. Current forecasts by the Wisconsin Center for Nursing show a deficit of 3,700 nurses by 2020 and over 16,000 by 2030. National surveys that are modeling forecasts that use a little different methodology also show a shortage of nurses by 2030 of almost 5,000. So these are concerning numbers. We have a graduation capacity gap in the state. We only graduate around 3,000 nurses a year. In Wisconsin, we have 20 baccalaureate programs, 22 associate degree programs, and 15 associate degree to baccalaureate degree programs. So schools continue to turn away many, many hundreds of qualified students. We lack faculty and lack of clinical placement sites are the two most frequently cited reasons for not graduating more RNs. In terms of the advanced practice nurses, the state average of nurses here is 10% of RNs versus, nationally is 10% of RNs. In Wisconsin, it's 6% of RNs. So we're not quite keeping up with the national averages in terms of the number of nurses number of advanced nurses we have compared to the nurse workforce. This may be due to our limitations in our scope of practice law. We have some issues around diversity of our workforce as well. Although we're seeing slow change, the diversity of our nurse workforce doesn't reflect the state's diversity in either race, ethnicity, or gender. We also have a little concern with our educational levels. The Institute of Medicine and others have recommended for many years that we have most of our nurses, 80% of our nurses, be educated at a baccalaureate level for the generalist nursing practice. Right now we have 56% of our nurses with a baccalaureate degree. It's changing. The younger nurses that are graduating now, 66% of them are coming out of baccalaureate programs compared to 33% from associate degree programs. So it's moving in the right direction, but we still lag behind that national goal. I think we've talked already about the demand drivers for more nurses. It's the same kind of drivers that are affecting the other health professions. On the supply side, we have slightly different supply drivers. I think the demographics certainly affect nurses as well as everybody else, but the average age of a nurse now is 47, and the average age for a faculty member is 51. In our RN survey in 2016, we found that 58% of nurses and 59% of nurse faculty expressed an intent to leave their positions within the next 9 years. So some of this is due to retirement, some of this is due to dissatisfaction. And probably a number of other reasons as well. Job satisfaction, burnout, stress, fatigue, chronic pain, and safety concerns all contribute to nurses leaving their jobs and leaving the profession. And this is a particular concern among new nurses, with 30 to 50% of new nurses changing jobs or leaving nursing within the first 3 years. So we spend a lot of time educating them, and then they decide it's too hard, once they get out. So we really need to look at that. It's also a problem for aging nurses. Even though we may be aging well, it's more and more difficult for nurses as they age to sustain practice in some areas because of fatigue, because of chronic pain, and other kinds of safety concerns. We need to look at how we help our aging nurses nurse better. We have the faculty shortage, which is what I talked about, that's creating this bottleneck of getting more students out the door. Economics plays a part in nurses as well. In times of recession, nurses tend to come back into the workforce if they've left the workforce, and in times of economic booms, nurses leave the workforce. As our economy improves, we may see some of that shifting of nurses back out of the workforce. I just wanted to spend a few minutes because I was asked to talk about what the School of Nursing is doing, and this is an example. There are schools of nursing all across the state that are doing really great things to try to address these workforce issues. First of all, of course, we educate nurses for practice as generalist nurses, as advanced practice nurses in geriatrics, mental health, and pediatrics, and as PhD prepared faculty and researchers. We've increased our baccalaureate nurse enrollment. We now admit 160 students per year. But as I mentioned, we turn away many qualified applicants. We turn away 3 qualified applicants for every one that we admit. Over the past 5 years, we've turned away 950 qualified students to be nurses. And this is because we don't have sufficient resources to train these students. And that's with regard to both faculty and clinical placement. We have started an accelerated BSN program, so this is for second degree students. It'll take 12 months for them to complete this program. We're starting this in May. We're starting with 32 students, and we will likely increase this program over time, so that's going to help us get more nurses out the door faster. We also collaborate with other schools in the state with the AD completion program called BSN at Home. This is an online program. It's available to anybody, anywhere in the state. And we have capacity in that program, so we'd like to get more students into that. We're also trying to get faculty trained and up and out the door faster. We have an early entry PhD program where we identify students in their baccalaureate program and help them work through and learn how to be a researcher and how to be a faculty member and get them out the door earlier so they can have a longer career as a nurse faculty. We are trying to deal with the diversity issues as well. We have a long history of working with campus on the People program for middle and high school students to keep them interested in nursing as a career. And our classes are actually getting more increasingly diverse. Our current class is 18% male, 17% students of color, and 33% students in first generation students. So we're making some headway there. We're going to continue to work hard in that area. We've started a process called holistic admissions, which is an evidence-based approach to enhance diversity of nursing student classes. This recent class for the accelerated program was done with holistic admissions, and it's resulted in a class that is more diverse than our traditional class. We're also doing a lot of supportive programming for students. One example is STREAM, and that's a new program where Native American students who want to become nurses engage in special activities, have a mentor who's a Native American RN, have individualized planning and a stipend, and we're going to hear more about the Native American students later. Of course, we also do a lot with scholarships. It's another way we support students at all of our levels. However, the demand for scholarship funding is a lot higher than what we have available. We're trying to get students out to areas that we know it's harder to recruit nurses into. We do a summer immersion program in rural Wisconsin, Barron and Rusk counties, where we take students out for 3 weeks and introduce them to rural nursing and public health nursing. We're also using simulation more and more. We're using it to enhance and extend education experiences and try to reduce that demand on the clinical preceptors and clinical sites. So I just want to touch on 2 additional examples of faculty-initiated projects where faculty will write grants and bring new federal and foundation money into the state to do these projects that contribute to nurse retention and satisfaction issues. So one example is what is called eSchool Care. Lori Anderson from our faculty used federal funds to develop a web-based mobile resources for school nurses. A second example is the Jerry Res program. This is an online nurse residency curriculum for nurses in long-term care, created by Barb Bowers and Kim Nollet using Cargill Foundation funding. And there are tracks in this program for nurses and their coaches in skilled nursing facilities, assisted living, and in-home health. I really appreciate the comment made about the community workers and how important they are. So just to end then with some considerations for policymakers, I think we really need to focus on two big areas. One is investing in nursing education to get more nurses out the door. The other is investing in our currently practicing nurses to keep them where they are. So more faculty is key to addressing the nursing shortage, and factors necessary for increasing faculty include support for education, grants, loans, fellowships, scholarships, loan forgiveness programs. The program Nurses for Wisconsin was a great start in that area. So those are very important programs for faculty. Earlier entry to graduate programs to extend career time as faculty is helpful, and of course competitive salaries and other incentives for academic careers, because we know that actually about 2/3 of DNP student graduates and about the same percentage of PhD graduates actually pursue non-academic, non-teaching careers. So we've got to produce a lot more of them to get our faculty up. More support for BSN education, scholarships, rural training programs, nurse residency programs are really important to new graduates. They look for places that have a nurse residency program. It's a great tool for recruitment and retention. And also organizational partnerships to support students and preceptors in clinical placements is something that we're really working on with our partners here. I think in terms of other policy or considerations for policymakers related to the practicing nurse, data is vital in any planning and evaluation processes. A lot of our data has been coming from the mandated RN survey, relicensure survey. This has been extremely important data to the state. We need to maintain and enhance Wisconsin's workforce data centers. We need to support new nurses. This is really important. Acute care residencies, as I mentioned, have been shown to improve retention, lower costs, and improve preparedness for practice. We could also use that residency model more in rural areas, in long-term care, for public health, for many other specialties where it's hard to find and retain nurses. And we need to look for additional ways to support nurses and improve job satisfaction in order to reduce that turnover. Better salaries, better benefits, better work environments where nurses have a say in patient care decisions, and a variety of programs that address nurses as they age to stay healthy and active in the workforce. In the rural areas, I think peer support networks would help, and also ongoing continuing education opportunities. So, and then finally, just with the advanced practice nurses, I think we do still need to look at that reduced practice laws that restrict our practice, because I think states where those restrictions are gone are more likely to attract nurse practitioners to practice. So if we did something about that law, we'd probably attract more nurse practitioners to practice in our state. And finally, I just have to put a shout out for school nurses. For every dollar invested in school nursing, society saves $2.20. So only 60% of our schools have school nurses. I think the whole state could benefit if we had more of our schools with school nurses. So just to summarize, the key points are the nursing shortage is going to get worse unless we invest more in nursing education and invest more in the retention of practicing nurses through working conditions and residencies and so on. And I think we need to maintain our efforts to continue to collect workforce data so that we can know whether changes we make a difference. So thank you.